Holy mackerel.
It fell down inside the big pieces. So Gene, you have some ears to clear out. Can you tell any difference in your hearing?
A little bit. I had to turn up the TV a little bit more than I usually did.
Okay, yeah. We can help with that. So the right ear has wax. And we will help. Am I hurting you at all?
No, I can hear it popping and moving around in there though.
Let me just put that here. It's fairly soft wax, so I think I hit a hard part there though. Yeah, there is a hard chunk in there. Is it hurting a little bit when I hit that?
Just a little bit, yeah.
Now, I think what happened was you softened some of it up, but the deeper stuff is still hard. When I look, I see that we got through some of it. Wow, it looks like there's already places that there's been blood. I don't like that at all. And we just got in there. So it's hard to imagine that just that little bit of touch, but I think most likely we caused that bleeding that we see there. So we're going to have to do something different than what we just did, because I don't want you bleeding. This may be a good place to use the irrigator to irrigate that out more gently than with an instrument. And even though this is soft, the lining of the ear canal is so tender that just simply touching like I was there can cause bleeding like that. Okay, so I may have you hold this like that. It's going to be loud.
Okay.
Sorry. Getting a lot of stuff. Let me stop, because if we look inside of your ear, right at the opening of the canal, it was just got so much of a collection of material that just came out of there. That might be all we need to do. Boy, that wasn't even half of one of them, was it? Let me take this away out of your ear.
Yeah.
Gold.
Yeah.
This is the right ear after irrigation. And the eardrum is great. That's the eardrum. That's a good looking eardrum. A little bit of stuff there near the top. A little irritated with some redness. You can see where the ossicles are sticking out through the ear, not sticking out, but against the eardrum on the other side. And then a little bit of blood on the floor of the canal. Yeah. So we caused some trauma there. We're going to let that heal up. And then we'll recheck it at a later date.
Okay.
So now, you can hear well?
Yeah. Yeah, I can hear.
You feel like it's any better than before we started?
Yeah, it seems like it is, yeah.
Okay, so we'll turn this around and we'll see what we have going on the other side. So we already looked in it earlier. And now, let's see if I can just put that in that little opening there. And any pain?
Nope.
So you can see some of it here, the initial, yeah, it's trying to get all together, but it's breaking up. So we get that one, oh, that one on the floor. Did you feel it?
Yeah, I felt it hit my hand.
Hit your hand on the way down?
Yeah.
Take some of that off.
It's been pretty big.
If you could feel it?
Yeah.
Yeah, there's still some down there. Getting caught in the hair in the ears. A little bit more. Nothing too amazing. Okay, let's go ahead and, oh, wait, a little bit more here. All right, now let's go in. And I thought that maybe I was breaking through and getting a whole lot out, and what I see instead is, no, there's just more wax behind that wax. And we're going to do the irrigation on this side now. Try to get it positioned in a way that it can get back in the canal. I'm not seeing where the water's going. I guess it's going in. Okay, I thought maybe it was running out. We got some wax coming out already. Oh, look at that. Looky, looky. Wow, let me grab the curette. Gene, this is good stuff. Look at that. That makes an impression on you.
Mackerel.
Did you want to take this home in a doggy bag?
No, thanks.
Okay.
That's gross.
Let's get the rest of that out of there. There's still some coming out of the opening. It's just all caught in the ear hair there. Let me take this down for now and pour it out. See that there? I just want to grab it and pull it. Oh, it broke. All right, well, what did it break off of? Oh my goodness, look at all that wax that's still in there. Even after all that. Oh, I think I just pulled a hair. All right. Can I grab that with this, or will it just go right through it because it's so soft? It just breaks apart like cheese. Why do doctors always use food analogies? Go in the canal and... Boy, it's dripping everywhere. Oh, look what came out though.
We've got a big old piece.
Yeah. Okay, we're going to have to reconnect here. Try like that, because water started just pouring. See if this works better. Is it going in the cup?
Yeah.
there's still some in there. Okay, we'll take it away. Oh my goodness, can you believe there's still wax, but now we get our first view of the eardrum. And it looks pretty good. I'm gonna try to angle it better so I can see it. It looks a little irritated, a little bit of where you can see the blood vessels. Nice view of the eardrum. I'm not going to mess with any more wax out of concern of damaging the canal or causing an abrasion. But good eardrum. Are you glad you did it?
Oh yeah.
Okay. I wasn't so sure.
It's going to get worse and worse. Yeah.
Worse and worse now on?
No, if I left it.
Oh, if you left it, yeah, that's right. Yeah, no, you're good now. So this concludes the ear cleaning.
Okay.
And thank you so much for sharing with us, Gene. We appreciate it.
Okay.
And for anybody who's interested in seeing Gene's blackheads, that will be a separate video. So keep an eye out for that. Until next time, Gene and myself telling you to stay in good health.